The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, of course, along with Otto, Lohse, Kristina Lou, and Dan Cox, and we are your team here at Project Independence and You. Of course, Kristina pulls these shows together every week, and we have our annual visit from Barry Klitsberg. We're so happy to have Barry here. Barry is an assistant program coordinator over at Nassau County HIICAP program, and we're going to be talking today all about Medicare open enrollment for 2024. So thank you, as always, for joining us.
Thank you for having me. It's great to be here. It's great to see everybody again, and we look forward to being able to help all of our seniors and Medicare beneficiaries in the open enrollment season.
Great. That's so good to know. And Otto, thanks. We missed you last week. I know you had a nice golfing trip somewhere, and
actually there's going to be a long story connected to that. We can get into Toast of the Town.
Toast of the Town. I think I know where this is going. I think that's Talk of the Town, but all right.
Talk of the Town, right. Well, I ran into a little bit of a glitch. I was on a blood thinner and I wound up with some issues with bleeding, and I was unable to go to the golf thing. So,
okay. I didn't know you didn't get to go.
That's a whole story about.
All right. We'll get into that for sure. But as long as you're okay and healthy.
I'm fine. And I learned a lot about blood thinners and how to prevent bleeding.
Okay.
So
all right.
We'll get into that.
We'll get into that later on. And, we're just glad that you're okay and you're here. And I'm sure there's more golfing trips in your future.
There was one yesterday.
Oh, okay. All right. So we're okay then. But Barry, thank you so much, like we said before, for joining us. And curious, compared to 2023 open enrollment, are there a lot of changes? Is it confusing? Where's the best place to start?
There are a lot of changes. The number of drug plans in New York State went down from 19 to 15. There are 36 Medicare Advantage plans, which people can choose from. There are 15 HMOs, health maintenance organizations, 21 preferred provider organizations, which is another form of managed care with a little more flexibility. So it is confusing. People got letters from their existing plan, whether it's a drug plan or a Medicare Advantage plan, at the end of September, telling them about the changes. It's important to do a couple of things. First of all, read your mail from your plan. If your plan sends you a letter, read that. Usually it's telling you your costs are changing, ordinarily going up, not in every case, but you need to know what your plan will be for next year. And that notice tells you that. The other thing to make sure you keep, I don't expect people to read it, is your Medicare and You book, which you got by the end of September also. This book gives you a description of the program, plus in the back, it gives you a summary of the drug plans, the 15 plans for next year, and all of the Medicare Advantage plans. So it's in the back of the book. Now, we don't expect people to read this cover to cover, but it's a good resource to have. It's a good reference. The index is very detailed. It tells you all of the different aspects of the program and where you can find it in the book. So when you get the book, take a quick look at it, but hold on to it, because during the year you may have questions, and this is a good resource.
Barry, I did get the letter you're talking about from Empire in my case, and it's because it's Medigap. My understanding is that does not have to be handled during the enrollment period, and they're very vague about what the rate increase is going to be. They're asking 15%.
They're asking for an increase. It hasn't been approved yet by the state. The New York State Division of Financial Services approves rate increase requests from the Medicare plans. Even though the benefits are controlled by the federal government, federal law, the prices are administered by the state. And you're absolutely right, where if you have a Medigap plan, there's no open enrollment season in New York. There's continuous open enrollment. So if you have a Medigap plan, say Plan G or N or one of the old plans like F, if you have that plan, you can keep it as long as you want it. It's called guaranteed issue, as long as you pay your premium. And if you decide you want to change to a different plan, you can do that anytime during the year. There's no enrollment season. And the change is effective the first day of the month after you make the request. So Medigaps have a lot of consumer protection, and they give you, there's a lot more flexibility.
So Medigap, so the open enrollment period applies to Advantage plans and drug plans, basically.
Correct. Advantage and drugs. And if you're in an Advantage plan, you have an additional enrollment season. It's called the Medicare Advantage Open Enrollment Season, which runs from January 1st to March 31st, where you can switch your Advantage plan to a different Advantage plan or drop it. You can drop your Advantage plan, go back to regular Medicare or traditional Medicare, and get a drug plan. So you have that extra enrollment period for Medicare Advantage.
Barry, you mentioned before that there are 36 Advantage plans, and then you talked about PPO and HMO. Are they considered Advantage plans?
Those are. Also
Okay.
known as Part C of Medicare.
Right.
Advantage plans are different forms of managed care. HMOs and PPOs, the Preferred Provider Organization, are forms of managed care. With an HMO, you must use the providers in the network, and often, not always, but often, you need a referral to see a specialist from your primary care physician. Except for emergencies. Emergencies, you don't have to deal with the network. With a PPO, you can go out of the network and you still have coverage, but you have a higher copayment if it's out of network. Still covered, the bulk of the cost is covered, but your copay is a bit higher.
So when you look at an Advantage plan, you should know whether it's an HMO or a PPO.
Right. And if people call my office, and I'm going to give the number in a moment, we can send them a summary of the plans for Nassau County, HMOs or PPOs. We have summary sheets for both types of plans, and it describes the premium cost, the copayment, if it covers drugs, and almost all of them do, and their other benefits. Right? If they have vision or hearing or dental benefits, some plans have fitness benefits. So there are additional benefits that Medicare doesn't cover that the Advantage plans can. They don't have to, but they can, and most do, as an incentive to get people to join.
Now, if you're so inclined, getting the material from you before the show, you had a link in there, which mine was a PDF document, so I couldn't use the link,
Right.
but it was Best Medicare Advantage Plans. Is there a link you could go to also to see that list?
Well, we don't have electronic. We have electronic versions, but it's not hooked up to a link. So if people
Okay.
want to get a summary of the plans in Nassau, they can call us, and I'll give the number. It's 516-485-3754. And I'll repeat that during the broadcast. But it's 516-485-3754. You may get me, or you may get one of our other counselors. We have some excellent volunteers, and they can send the list of the Medigap plans. They can send the drug summaries. They can also send the Medicare Advantage, and we separate it out by HMO or PPO. So people can get that, and they can see what they might expect to pay for the various services.
So the danger, like in an HMO, you talked about, you have to have doctors in network. Suppose you run into a problem, let's use the word cancer, and you have to go to some specialist because of it. You could have a problem if that doctor's not, the one you really want to go to is not in the HMO. You wouldn't be covered, basically.
You're right. And one of the examples I use is similar to what you're saying. If you need to go to Sloan Kettering in Manhattan, they may not be, or probably not going to be in your network for a Nassau County managed care plan. Hospital for Special Surgery, the same thing. So you have some very well-known facilities that people tend to flock to because of their reputation. They're not going to be in the network in a Nassau County plan. They're not in the network for most New York City plans either.
Hmm.
So these
So-
are things to consider. And I use that example often when people say, well, I can save money or get other benefits. And it's absolutely true. That's the good part of it. No premiums are low. But you may have a problem if you want to go to a provider that's not in the network.
So like for the examples you gave, you don't know at the beginning of the year what's going to strike you or me or anybody as far as that goes. Stuff can happen, and people like wind up with joint replacements and maybe they have to go to a special surgery type of place, or that's the choice that they really would like to make.
Right.
So you're kind of gambling a little bit, it sounds like.
In some cases, yes. I mean, people call me all the time and they start to give me their medical history. And the first thing I do is stop them because my answers are going to be the same. But sometimes you have to tailor based on what they need. And that's when I'll ask them, do you have any special conditions? Because a lot of times people will just call and say, I have this disease, I have that disease. I say, let's get to that later. First, give me your name, right? And then we can start a conversation where as the more detail I need, I can help them find the right plan. With the Medigap plan, like what you have, Otto, and I hope I'm not divulging information.
No. I use
But
Plan
you can
N.
use with the Medigap plan, you can use any provider in the United States or its territories that is in the Medicare program. Medicare will pay and automatically send that information to your Medigap insurer. So you don't have any paperwork and you have coverage anywhere you go.
Well, one of the things like this past year, right? I had like $12,000 worth of dental bills,
Mhm.
hearing aids for $5,500. So that's the biggest cost I had medically. All right. So I did scan through some of the Advantage plans, and they talk about hearing and vision and uh, dental, and then I look, and then it says, okay, dental, $500 a year, uh, for dental. Okay, great. So that covers a couple of cleanings maybe, and that's it. And then you have to hope that your dentist is on that plan. And then the other one is hearing. They talk like $1,000. Uh, I think you have to dig pretty deep into these Advantage plans to know what you're really getting into.
You do. And because they're not standardized like the Medigaps are, the Medicare Advantage plans each has their own benefit list and they're not the same. So you need to go into the details. What do they cover for vision? What do they cover for dental? Many of the plans will do preventive dentistry, but if you have a lot of work that you need to do, they may not cover periodontics or endodontics. So you need to check. And again, if there's a network, you need to make sure that they're in the plan.
So basically, comparing Advantage plans could take a lot of work.
It does. That's why we put at least a summary together so people can get a head start. When I send the summary out, I tell people, first thing you do is when you get this list, talk to your doctor or his biller or her biller, because they know better what plans the doctor participates with. Then once you know that, then we can go to the individual plans that the doctor is in the network and find out what are the benefits that those plans offer and what's important to the client. So we can then hopefully tailor it a little bit further.
Okay.
It's complicated.
It's very complicated. And I know in just a moment or two, we're going to have to take our first break. But I wanted to kind of back up a little bit because, with all the baby boomers now turning 65, 10,000 a day supposedly,
Right.
I'm going to assume that there are thousands and thousands of new Medicare recipients each year. And, so there may be some listeners who for the first time are hearing about open enrollment. It could be their first year on Medicare. So I wanted to kind of just go through, if you would, the different parts of Medicare, A, B, C, D, and what their functions are, and what parts are really for open enrollment. I mean, there are people that, I'm going to assume, especially early on with Medicare, may ignore it all. And like, what happens if you don't re-enroll? Do you go to what you were, and, is it just stay the same? So I want to kind of talk a little bit about the newer Medicare people, and, kind of give them a little bit of advice and that.
Sure, no, that's a good question. Medicare has a few different distinct parts, like you mentioned. The basic program is Part A and B. Hospital insurance is Part A. It's premium free for most people because they work and pay their FICA tax, and that gives them hospital insurance without a premium. And that covers you when you're an inpatient at a hospital, acute care hospital, or a rehab hospital. It also can cover home health care after a hospitalization, and that's skilled care. A nurse, speech, physical, or occupational therapy. All right. It also can cover hospice care. That's care for people who have a terminal illness, for pain management and symptom relief. Not a cure for the disease, but palliative care. That's your hospital insurance. And it covers all of the routine services in the facility: room, board, special departments, okay, equipment you may need while you're an inpatient, drugs while you're an inpatient. So that's Part A. Part B is your medical insurance. That does have a premium, and it's going up from $164.90 a month this year. It's going up $9.90, all right, to $9.80, $174.70 next year. We just got these numbers this week. So that covers you when you have a doctor service in the hospital or out of the hospital. All right, like if you have a surgeon that bills separately, anesthesiologist, your attending physician who is coming to, see you in the hospital. The physician services, outpatient services. Let's say you go to an emergency room and you're sent home, or you have a test or an outpatient surgery in the hospital. That's covered under medical insurance.
You know what, Barry, we're going to have to take a quick break, but we'll come back to this Part B because I think a lot of people are, this is important information for them. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Kristina Liu and Dan Cox. And today we're speaking with Barry Klitsberg and all about Medicare 2024, the updates and open enrollment. And before break, we were just talking, kind of giving an overview of all the different parts of Medicare, parts for a lot of the newer recipients of Medicare. A lot of people are turning 65, the baby boomers are coming up and all of that. One thing I just wanted to ask, so people, for example, who work for government and may be vested might have a plan, maybe carrying over their insurance into retirement, like government NICEP or something like that. Mm-hmm. Does that affect the 174 and change that you'd be paying a month because you're also going to be relying on that insurance? Like, how does that work?
Okay. If you have a retirement health benefit, that usually supplements your Medicare. So Medicare is primary if you're not working, or if your spouse is not working and your coverage was from your spouse. Medicare is primary. Your union, your employer, or your government benefits are your supplement. Some plans, especially like the New York State and county employees, get their Medicare premiums reimbursed. Like, as long as you have that plan, like the NYSHA plan that you mentioned, that will pay your Medicare Part B premium. Usually they reimburse you once or twice a year, but you still have to have your Medicare A and B. And that's your supplement and your drug coverage. So now, like I was talking before, and I'm going to get into some of the a little bit of the details, but Part B, your medical insurance covers your outpatient services. It covers doctors, outpatient surgery, ambulatory surgery, emergency rooms. It covers durable medical equipment, outpatient lab tests. And Medicare will pay 80% of the approved charge, persons responsible for 20%. Medicare also has a drug program, Medicare Part D, and I'm going a little out of order deliberately.
Okay.
Medicare drug program are separate. There are 15 in New York State. So we can help a person pick a drug plan based on the drugs they take and their pharmacy. Because we get questions, what's the best drug plan? Well, what drugs do you take? Where's your pharmacy? So we can see if your pharmacy is in the network for the plan, and we let people know what plans will cost them the least for their drugs and premiums combined. That's Part D. Now, Medicare Part C is Medicare Advantage, like we were talking about, the HMOs and PPOs. They're also known as Part C. And most of them also cover drugs. So people who join a Medicare Advantage plan get their Part D coverage added in to their Medicare Advantage. Most plans do cover drugs. The only plans that don't are designed for people that get their drugs from the VA. Mm-hmm. And if you look at the plan name, it'll say the Medicare Honor Plan or the Medicare Patriot Plan. Those are people who are veterans who get their drugs from the VA. So you have A, hospital, B, medical, C, Advantage with the drug benefit and other benefits like vision, dental, and hearing to different levels, and Part D, which are specific to the drugs. If you work for a company where you have a retirement benefit, like you mentioned, or an agency of the government, that would be your drug benefit and your supplement. And some people just buy a Medicare supplement if they don't have a retirement benefit. Those are called Medigap. They work with traditional Medicare to cover all or part of their cost share, the Medicare, the portion that Medicare doesn't pay, hospital deductibles, the 20% co-insurance. There are 10 different levels of benefits, a number of different companies. The prices vary greatly. I'm not going to mention companies, but there is like Plan G, which is a very good Medigap plan. Premiums go from $281 a month to over $700 a month. And I can't answer a very common question. Why do people consider paying $700 a month for the same plan that's $281? Because by law, any Plan G or Plan N, anyone in that band has the same identical benefit. So I
it doesn't
can't
matter
answer
what company you use,
right.
You're going to get the same benefit, period.
Exactly.
It's law. So,
that's right.
So
it's in
you're
federal
right,
law.
It doesn't make any sense at all to pay 700 and something for something that you could get for two something and get the same exact coverage.
Exactly. I don't understand that. I think maybe if you deal with a company that has other services, you may get a break on your homeowner insurance or something else. But otherwise, I can't see any benefit.
Now, Barry, is Part A and B the same no matter who you are or what coverage you have? If you're on an Advantage plan and A and B are now part of C, basically, is A and B exactly the same no matter what?
Not necessarily. Well, the benefits are, but the costs can vary. When you join a Medicare Advantage plan, the HMOs, or the PPOs. What you're doing is saying, I will get my health care through the plan. So you put your Medicare card in your drawer. And when you get health care, you show them the card from your Advantage plan. And they will bill the Advantage plan, not Medicare. So
Okay.
You're entitled to the same rights as a Medicare beneficiary. If you disagree with the decision, you want to appeal any kind of a denial, you have the same rights as any Medicare beneficiary. The process is a little different, but the rights are the same. It's just how you get your care. When you sign up for an Advantage plan, the plan is responsible for payment and providing your health care.
Yeah, what I liked was a description I saw somewhere in your stuff about the Advantage plan is basically a privately run version of the government's run Medicare program. That's what it is. The government is not involved. It's a privately run Medicare program.
Right there, if you look at the plans and you see which companies are offering them, you may have Empire Blue Cross Blue Shield, you may have United Healthcare, Cigna, Aetna, all the big insurance companies, and they are administering these plans. Now, some of these plans, they work for a lot of people. People ask, how do these plans get paid? If they don't charge a premium, how do they make their money? The government pays the plan a certain amount of money every month for every beneficiary that signs up. So that's how they get their payment. They get their payment in addition to a premium they may charge, or you have your copays. But they get paid by the federal government based on a formula that's county specific for each beneficiary. And that's how they make a lot of their money.
I never knew that. I often wondered, like the Humana is one that comes to mind.
Right.
No premiums. So
right.
That kind of always gets me. Like if something's free, there's got to be something. There's a trade-off.
Yeah, nothing is free, but in this case, you're not paying the bulk of the cost. The government is. It's based on part of it is based on the cost for average spending per Medicare beneficiary in that county.
Yeah, the hard thing though is if you're getting this premium for free and then somebody else says, I'll give it to you for $50 a month, you don't really, it's very hard to me anyhow, an outsider looking in, to say, okay, what am I getting different here for the no premium and the $50 premium?
Well,
it's like,
they may have a lower deductible for their prescriptions. They may offer some other benefits or lower copays for doctors. So that's why people should call me at 516-485-3754. We'll send them the summary so they could see what are the premiums, what are the copays for doctors, what do they have to pay when they go into a hospital or for outpatient services. And there's usually a range for outpatient because we don't know what they're getting. But at least they'll have a good idea of what they might be responsible for so they can make an informed choice.
Now, I think that's great stuff because I looked at it a little bit myself and I surrendered. I'll be blunt with you. I'm looking where I can get my $12,000 for the dentist and my hearing aids for $5,000, and I couldn't find any.
The Medicare website actually, and again, I've been doing this since Nixon was president, working with Medicare, but the Medicare website actually, you can get a lot of information, but you have to know where in the weeds to look. For each plan, there's a button that says details. And as you go through the details for that plan, there are additional buttons for more details. And you keep going through, and then you find your extra benefits. And it'll tell you what the hearing benefit is, what the vision benefit is, what the dental benefit is. And that's where we get a lot of our information. It's not in the summary, but we can help people find that. And you can even go plan specific. Or if you just want to look at PPOs instead of HMOs, there are ways to go on the Medicare Plan Finder to do that.
Now, you talked about 36 Medicare Advantage companies, or not companies, but policies, I guess.
Right.
So basically, what you also talked about was providing what you think are the top choices out of those 36.
We can help people. When I send out a worksheet to people that says, you want to know what plan covers your drugs the best, send this back to me. Give me the names of your drugs, the dose, and the strength, and how many you get every month. If you take, like, say, Lipitor, it'll say the name of the drug, the strength, 10 milligram, 20 milligram, and if you take one a day, that would be 30 a month. And based on the information you put there, I can then pick the top 3 plans for you based on the cost. Now, if it's an Advantage plan, the things I cannot find out are your overall health costs, because we don't ask you how often you go to the doctor. So what are your copays? We could tell you what you would pay per visit, but we don't know the total cost. We do know that for drugs because you're telling us that. But some other stuff like emergencies, or just, if you go to the doctor every 6 weeks to get your blood pressure checked, you can figure that out. We don't have that information because we don't have you in our file. We don't have your healthcare records. What we can do is, based on the information you give us for your prescriptions, tell you which drug plan or Advantage plan gives you the best deal for your drugs.
But then there's always the X factor. Like last November, I'll talk personal here. It doesn't matter. I had a stent, and after the stent, you have to go on a blood thinner. So they put me on Brilinta, and all of a sudden, I get this drug thing for $400 for pills that weren't in my calculation at the beginning of the year. And
now, that happens often. And again, Brilinta is a brand name drug, so it's expensive. It's not a generic.
Right.
If your income for an individual is under $75,000 a year, or $100,000 for a couple, I suggest people look into what the New York State EPIC program, which can work with your Medicare drug plan to help lower your costs. The fee schedule is based on income, or your deductible for your drugs is based on income. But once you're in the program, and if you have a deductible and you meet that deductible, with EPIC, you don't pay more than $20 a prescription.
Well, the other part of it is, frankly, I talked to the doctor afterward, and he put me on a different blood thinner that was less expensive, basically. And, maybe there's a touch difference. I don't know. I'm not on it anymore, thank God.
But that, again, people will tell me I'm paying this. There's some expensive brand name drugs that are very popular, and I'm not going to mention names because there's no MD after my name. People will call and say, I'm taking this drug, it's expensive, what can I do? So I give them the various programs that could help lower costs in many cases. But what I won't do, and I tell them this, is I'm not a doctor. You have to talk to your physician about what he's prescribing. If it's an expensive drug and there's a generic or a lower cost alternative, ask your doctor about that. I can't help you because there's no MD after my name.
In my case, I'm just talking as a citizen who's a user of a drug, not a drug, but,
No, of course. But again, we get this a lot. And, there are, for many medical reasons to take a brand name drug. Even if there's a generic equivalent, sometimes people prefer the brand name drug because if it's a pill, sometimes the filler in the generic tablet gives them a rash, gives them side effects. So, and I get this sometimes, that they do better with the brand name drug, even though it's the same medicine, other, unintended consequences. So I talk to your doctor, try other things, talk to him, see what's available. If it doesn't work, your plan may still cover it, but it's going to be more. Then we'll talk about EPIC or, extra help for low income folks.
Well, the other thing we talked about before the show started was that there are various discount programs out there. Like I wound up saving a lot of money this year, actually, by going through GoodRx as an example. And there are a lot of those kinds of programs around where Zetia is one. It was like $140, and I go on GoodRx and it was $34. Same stuff, same everything. I didn't go through my insurance. I went through GoodRx and I saved $100.
Yeah,
It's worthwhile.
there are a number of discount programs that work for a particular drug, especially brand name drugs, where you can save more money than with your Medicare drug plan. If
Yeah.
that's the case, keep your Medicare insurance. You don't want to drop that. But for a particular drug, if you can do better with Good RX or, Agility RX or any of these programs, use that instead.
What was that last one?
I
Agility?
think it's called Agility.
Agility. Okay.
Yeah. But there are quite a few of these plans. Some of them advertise on TV. And if you do better with a discount program for a particular drug, use it.
Yeah, and people should be aware that that's a good thing to look into. If you have a
Absolutely.
drug,
You know what? We have to take a quick break. So we'll get back to getting all this great information with Barry Klitsberg after a break. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We'll be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Kristina Liu and Dan Cox. And we're speaking with Barry Klitsberg all about Medicare 2024 updates and open enrollment. One of the things the listeners should know is, yes, Barry will answer the call. So if you call him, he will definitely get back to you. So Barry, why don't you give our listeners, if they have a pen out, they can also always call us at 311 because we have all your contact information. Just let them know the best way to get in touch with you.
Right. You can call our hotline at 516-485-3754. I'm in the office a few days a week when I'm not doing outreach, presentations to senior groups, radio shows. I haven't been on TV because I have a face for
This is TV.
You are actually on TV. I think, Kristina, maybe, you didn't let them know. North Hempstead Television.
Yeah, but so if you don't reach me, you can talk to one of our other counselors. All of our counselors are certified by the state. They have to be trained and pass an exam in order to become a HIICAP counselor in New York. So everybody gets the same training I do. I've been doing this a little bit longer than most, but everybody there can answer all of your questions. If you prefer, you can ask to leave a message for me, and I will call you back when I get back to the office. I have a little bit of OCD about returning calls. I was doing that this morning before I came on the air. So I will call you back if you would prefer to speak to me. If
And
you
that
get
is
the
an
voice,
honor in this day and age.
if you get the voicemail, leave a message. And again, any of the counselors can return the call. But if you say, I'd like to speak to Barry, they will leave me the message and I will call you back. During open enrollment, we're kind of busy.
Right.
So I changed the voicemail this morning. Usually we call people back the same day or the following morning, depending on when they call. Now it's 2 working days because we're getting a lot of calls, which is normal during open enrollment. So we will call you back. You can leave a message at 516-485-3754 and you will get a reply.
Now, interesting, you said something about you had to do this for New York State. So this is HIICAP is not just a program in Nassau County. It's a program that covers all of New York State, or?
Actually, it's part of the SHIP network, State Health Insurance Assistance Program, which is national. Every state has a program like HIICAP in New York. It's funded by the federal government. We have no affiliation with agents, brokers, insurance companies. We're funded by the feds. In Nassau County, there's a pass-through from the feds to the state to the county, and it goes to our program. So we don't work with any other companies.
So, I mean, as an example, if somebody has a father or mother or whatever who lives in Florida now, and they're in Florida, they could find a version of HIICAP in Florida.
Yes. In the back of the Medicare and You book, and I'll show it again, there's a phone number, and it's local. Well, in New York, it's got an 800 number. That will take you to our New York State Office for the Aging headquarters in Albany. They will automatically forward you based on your county. So if they ask you what county you live in, they will transfer your call to me. If you're in Nassau, if you're in Monroe County upstate, they will transfer you to the Monroe County in Rochester. So every county in New York State has a HIICAP program. In New York State, it's called HIICAP.
Right.
Okay. Barry, before we go on and talk about outreach and the fact that you're in our Pioneer newsletter, could you just talk a little bit about the enrollment timeline, where everybody should be at what phase, and especially for the listeners who maybe are a little newer to Medicare?
Sure. No, that's a good thing to reinforce to people. The Medicare open enrollment season, where you can switch your drug plan to a different drug plan, or your Advantage plan to a different Advantage plan, or drop it and go back to Medicare, traditional Medicare, is October 15th through December 7th. So that's when you can make any change to your Medicare enrollment. If you're in an Advantage plan and you want to switch or drop it, you have an additional time period, January through March. So you have a little bit of flexibility if you're in an Advantage plan. Also, I mentioned EPIC before, the New York State Drug Assistance Program. If you're enrolled in EPIC, you have a once-a-year chance to switch your drug plan. So let's say you're getting your drugs from one drug plan, and all of a sudden, there's a new drug out and they don't cover it, but another plan might. If you're enrolled in EPIC, you have a once-a-year chance to make that switch. And you could switch from your Advantage plan to another one, or your drug plan to another drug plan, or drop your Advantage plan to go back to a drug plan, because it's all tied in. I call it the get out of jail free card. EPIC gives you a little bit of flexibility. So if you want to change your plan outside of the enrollment periods, if you're enrolled in EPIC, even if you never use it, let's say you have a high deductible with EPIC and you're not going to meet it because you take generic drugs, but at some point you want to switch, you can do that because you're in EPIC.
So it sounds like it's not a bad idea if you're income qualified to get into EPIC anyhow.
I recommend it to people. A few years back, we had a major healthcare provider who dropped a plan. It was an Advantage plan. And this was effective October 1st. So they sent letters out in July, which is outside of the normal enrollment period. We had hundreds of calls from their patients. They didn't want to switch their doctor, but they wanted to switch their health plan. So we sent out boxes of EPIC applications. And once people were approved in EPIC, they could switch their plan, their Advantage plan, to a different plan that was still in that network for their doctor. So it gives you a little bit of flexibility outside of the box. Now, we talked about this during the break, and I want to make sure we discuss this. In addition to answering questions from Medicare beneficiaries on the phone or in person on occasion, we do outreach. And as part of our outreach effort, our agency, Family and Children's Association, has a smart van. This smart van has computers and printers in it, hooked into a wireless network. And if we come to your neighborhood, and it's like the ice cream truck, except we don't have the bells. But if we come to your neighborhood and we're going to be at Martin Park on November 14th from 10 to 3, if people want to show up, they can do that, make an appointment, and we will then take your drug list, and we'll go over your drugs and find if that plan works for you. or if you need to switch.
I don't think anyone even needs an appointment for the van. Even better.
You know better than me about the local gymnastics of the how that's
Right.
going to work. But I can only tell you, we will be there.
Right.
I will be in that van. I'm not driving it. We have a driver. And like I said, we don't have the Mr. Softy bells, but we will be there at the park from 10 to 3. And if you come in with your drug list, we will be able to run your drugs. We'll know what plan you have because you'll tell us, and we'll have a list of all the plans, and we can print out. And I usually print out the top 3 plans based on cost, and it's the premium and your copay, what you would expect to pay, including a deductible if it applies, how much you would be expected to pay. And if you decide, we can even sign you up at the time. Because on the Medicare website, there's a little button that says enroll. So we can help you find the right plan and help you enroll. All right, so that's the 14th from 10 to 3.
So if someone comes that day, they should have all their information because they could actually enroll on the 14th. Is that true? They can do everything they need to do, soup to nuts?
That's right. And once we have the information and you make a decision, the actual sign up takes 10 minutes.
Now, the
That's good
smart
to know.
van, just so I'm clear in my head, the smart van that day, its major intent is what we're talking about right now. It's the,
Well, for my
Well-
purposes, yes. There may
Well,
be
there's
other
several
things.
things going on that day. There's technology training, connection to resources, informal counseling, and then also Medicare open enrollment assistance
okay,
and more. So
and more.
there's a lot going on. I'm
Yeah.
sure
Yeah.
Kristina will be getting into that and talk of the town. I know she coordinated this whole program, and we're really happy to have it and to offer it to our residents. I think it's going to be a busy
while
day.
it's fresh on my brain here, how many computers will be there?
I don't know, maybe one, maybe more,
Yeah,
but I'm going to be there. So I'm going to take one person at a time. I will ask for patience because I don't rush people. People come in with questions or issues. I don't rush people. So when someone says, I'm waiting 10 minutes, my answer is yes, and you will get all the time you need to.
right, got it.
So, yeah. So, if there's no appointments, people come in, first come, first serve. I try to make sure when people leave, their questions have all been answered.
Well, and knowing Project Independence, I don't think you're going to be standing on line outside of a smart van. There might be some comfortable way to wait.
Right. I'm sure
And-
they're but
Of course, you can always wait in Clinton, in our building at Clinton Martin Park, and we'll, pending the weather and all that. And there are other things going on with the smart van that day. But like I said, Christine, I'm sure we'll get into that a little bit more. And also, Barry, you're in our Pioneer newsletter that I think will be hitting homes very soon, maybe like within the next week or two, Kristina, if not sooner. All right, she's giving me the thumbs up. So, and of course, the Pioneer newsletter is really pulled together by Kristina, and everything just fits timely as well. I mean, right now, Medicare enrollment's open. Barry, we've got some information in the newsletter from you as well.
can you send me a copy of that if you don't mind?
I'm sure she will.
Thank you. Yeah. Again,
Absolutely.
but I just want to, because I know we're running a little short on time, just remind people, read your mail. If it comes from Medicare, Social Security, or your existing plan. I'm sure every senior in the world is getting tons of mail from all the other plans. There may be good information there. You can also use it to wrap fish or line your birdcage with it because it's marketing material.
Or
but
carve pumpkins.
Right.
I do have a question about what's new. I read something, and that one of them was there's new is monthly services to cover chronic pain. Now, what does that mean, and what's an example of that?
I haven't seen what you read, but I
Okay,
know that like Medicare now covers acupuncture for chronic lower back
okay,
pain. They cover 12 visits with an additional 8 if medically necessary from a certified acupuncturist. You can't go to your local storefront, saying we do acupuncture. It has to be somebody who's certified and in the
Right.
Medicare program, and Medicare will cover that.
A
There's
chiropractor?
chiropractors covered very limited for what's called a subluxation or a slippage of the spinal cord. And they will cover that as long as the need is demonstrated on an x-ray. So they will cover some chiropractic services.
And physical therapy, of course, is.
Physical therapy has always been covered. A couple of years ago, Medicare did away with the cap. There used to be a dollar amount where the benefit would end. Medicare did away with that. Now, when you hit a threshold, all the provider has to do is certify as still medically necessary. And there's a code that they put in on the bill. So Medicare will bypass the edit on the system. And also, there's another threshold even higher where Medicare may request medical records to document this continuing need. But there is no more cap. And if sometimes people call and say, my therapist wants to stop because Medicare coverage ends, and I say, no, go back to your therapist, tell them to contact the Medicare provider relations people. They'll tell them how to bill or how to get around that cap.
Now, the other one I read was that there's now more health care provision.
Medicare, well, the Inflation Reduction Act did add additional cost reduction measures like insulin
Mental
has a
health
$35 cap.
Yeah.
That's for insulin, not for some of the other biologicals that you see advertised on TV because they're not insulin. But insulin itself is capped at $35.
What
So
about what, I'm sorry to cut you off, but it was important what Otto just mentioned was mental health.
Is what I really meant to say.
Mental health is covered, has been covered for years. A few years back, they changed the benefit from 50% to 80%, which is the standard for most Medicare Part B services, the medical insurance. So mental health is covered. Again, a provider has to be in the program, psychiatrist who's an MD or a psychotherapist. Certain social workers are also eligible for Medicare reimbursement. So they've expanded it slowly, but that's not really new, but people didn't know about it. So it's a good thing to mention.
Sure.
Mm-hmm.
And then Medigap would participate in the other 20%.
If Medicare pays the claim, the Medigap plan will pay its share.
Right. Okay.
Yeah. So again, the different Medigaps have different levels of benefit. So you may have a $20 copay. You may have a $0 copay, depending on the plan. Depending on your healthcare needs, we can help you find the best value in Medigap also.
Barry, quick question. I'd asked this early on and we just kind of went on. For our new Medicare recipients, people, maybe it's their second year or first year, what happens if you ignore the enrollment just because you don't really get it, or you just figure you're going to just get the same services as the year before?
Okay. If once you're eligible for Medicare and you don't take it, for every 12 months that you're eligible for Part B and you don't take it, there's a 10% permanent penalty. Now, if you're working and covered by active employment group health insurance, or your spouse is working and you're on their plan, you don't have to take Part B because Medicare is secondary to your employment plan. And if that's the case, there's no penalty for late enrollment as long as you enroll in what's called the special enrollment period. You can hold off on taking Medicare. You can pick it up within 8 months from the time you retire or the coverage ends, whichever comes first, without the penalty for late enrollment. And if people have further questions, again, call me at 516-485-3754, and we'll be able to give you the details based on your specific needs. Thanks again. This was great.
Thanks, Barry. We appreciate it.
All right.
As always, a pleasure.
All right. Otto, it's always good to see you. Take care. Thank you, Kristina.